And away from labor, Director of the Noguchi Memorial Institute for Medical Research, Professor Abraham Kwabena Annan, is confident a potential local medication will be a complete solution for COVID-19. The institute revealed the testing process requires input of resources, but most people who bring their drugs for testing are unable to provide the resources required. Here's a report that I did. As the world seeks to develop a cure to contain the COVID-19 pandemic, lives continue to be lost with cases on the rise. This development has even questioned the potency of scientists in coming up with a cure. At the Noguchi Memorial Institute for Medical Research, several local medications have been sampled which are undergoing testing to test its potency. The director of the institute, Professor Abraham Kwabena Annan, said there is hope with local cure as results from most tested ones are proving great results.
There's a lot of hope because we've received quite a number of drugs that are potentially to be screened for COVID-19. And then as we begin to do that, we'll be able to tell. But there is hope because it is likely that some of these potential expected products may turn out to be very, very promising and sometimes even a complete solution.
Presidential Advisor on Health, Dr. Anthony Nsiasare, mentioned that the world will come out of the woods soon.
Depending upon how every country is doing, the strategy that we have put in place, the measures that we have put in place, if the numbers are in ones and tens, we'll be very happy to come out and announce that now we are out of the woods and then we should go about our normal duties.
Earlier, the institute requested for 176,000 liters of intravenous fluid to aid operations, which should be provided latest by August. In that regard, 1 million liters have been presented by Intravenous Infusions Limited with a pledge to donate more when the need arises. Director of Intravenous Infusions Limited, Samuel Apentin, acknowledged the need to complement government efforts, calling on institutions, organizations and individuals to be agents of change.
We were the first to be established in this whole sub-region as an IV fluid plant from 1969, and then we started manufacturing in 1973. We will demonstrate our preparedness to sacrifice not just for ourselves but for the whole of humanity and for the whole sub-regional. But we will always be available to help support even further should the need arise.